Welcome to the Wellness Surge podcast with Dr. Adiola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more, so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Search podcast. My name is Dr. Adiola Oke, and today I have with me Dr. Rasheedah from the United Kingdom, and we're going to be talking about how to navigate infertility. Say hello to everybody, Dr. Rasheedah.
Hello, everyone. Thanks for having me.
Wonderful. Thank you for being here. We appreciate you. All righty. So Dr. Rasheedah is a general practitioner based in the United Kingdom. Like I said, with an interest in women's health. She has 7 years of experience, during which she has gone on to gain a diploma in obstetrics and gynecology, and also a membership of the Royal College of General Practitioners. She's also a clinical fellow and a tutor in King's College Medical School, London. She's passionate about women's health and family well-being, with her favorite quote being, "Prevention is better than cure." You know, that's totally my own quote too. Like, I'd rather prevent. That's my big thing. I'd rather we go on the prevention than curing, because if you don't, the money you're going to spend on prevention, or rather, let me say it this way, if you don't take care of yourself now, you're going to spend that money trying to cure whatever you didn't prevent, right?
Exactly right. Exactly.
All righty. So thank you. Like I said, thank you so much for being on the show today, all the way from the United Kingdom. All righty. So we're going to be talking about how to navigate infertility. So based on your experience, what is the state of infertility around the world right now? You know?
I think that there's two components to my response to this. I think that there's definitely been an increase in infertility around the world, but I think there's also been what I would like to call an apparent increase in infertility, just because of the way the world is changing. I think we'll probably expand on this some more, and I can kind of explain why I'm saying that. I think generally there's been a decline in fertility, but I think on top of that, the way that we're living our lives now and the decisions we're making about our lives and our future actually has contributed to that seemingly increase in infertility around the world.
Delvin, just let's
Okay.
explain more. Yeah.
Because if I were to break down infertility and the causes into, maybe broadly speaking, two separate groups, I would say that there's actually the factors that, environmental factors or things that are inherently wrong with an individual, like the physical factors. But I think there's also the social factors as well. I think I'll start off explaining social factors, because that's kind of what I meant by the apparent rise in infertility. Back in the day, people would have kids when they were in their 20s, but now you're seeing more people want to enter into the workforce. People are making decisions about when they want to have kids and delaying these kind of decisions until later on, when they've reached a certain, people are giving themselves goals, like saying, "Oh, I'm not going to start having kids until I've done this and I've got that master's degree and I've got this house." So that on its own actually does seem, or kind of paints this picture of infertility, because what then happens is, by the time that they're now ready to start to try to have kids, then nature kicks in, because actually infertility does decline with age. Okay. And that's a natural phenomenon. But because we're delaying the decision to have kids till later on, it then seems like infertility is on the rise. Does that make sense?
It does. So I want to break this down a little bit. Okay. So there are two things I'm hearing from this, right? You're saying it's an apparent infertility and then age, right? All right. So my first question is this. I see people in their 20s, okay, not being able to have a child. And it's really sad to them, because they're like, well, I'm doing it early. I'm trying early. Okay. And then the second one is, the other question is this. What is that age? When you talk about age, what is that like age? Like, you have to start thinking, okay, my clock is starting to tick down, right? So
I think I'm talking more about, like, first the instance of the 20-year-old who's trying to have kids, who unfortunately is struggling, then that person or that individual will actually fall under the physical factors that I was talking about when I was breaking it down into this kind of the contributing factors to infertility rise. So when we're talking about the physical factors, I think generally there's been a decline in terms of the purity of our environment that we live in. And, inhaling these fumes and inhaling all these particles that are in the atmosphere can have a detrimental effects, not just on our general physical well-being, like our lungs, our hearts. People know very much about that, but actually it can affect fertility as well, and can cause a decline in terms of sperm quality of the sperm. Actually, when you delve into that some more, it's not so much the woman, these impacts, it's more on the quality of sperm, because let's not forget, a lot of times when we talk about infertility, there seems to be this focus on the female and on the women, forgetting that there's actually someone else, a very important person in this picture, or a very important need for sperm, because it doesn't just happen with an egg. There needs to be a sperm to create a child. So that contributes to that. And there's also this, you asked the question about the age. Very controversial, but I would say, generally speaking, I would say that fertility tends to decline with age, generally with women, in terms of the quality of the egg. And I would say into your 30s, into your late 30s for women, that's changes start to happen. Because if you look at studies that look at the risk of having a child with Down syndrome, that increases with age, and that's to do with the quality of the eggs. Okay, I don't know how it works, and I'm sure they do it in the US as well, but over here, like when a woman's pregnant, as part of her antenatal care, she will have something called a Down screening, which is a combination of different things. So they will do a blood test, they will take her age into consideration, they will look at the scan for the baby, and then put all of those factors into this calculator to calculate her risk of having a child with Down syndrome. And that risk actually is very heavily affected by her age.
Okay. All right. Very good. Thank you so much for that. Because I'm like, what? Yeah. So that was really good. Okay. All right. So we know what infertility is. We know what is possibly contributing to infertility. So what is the usual way to treat it? How can we go about navigating this infertility?
I think it depends. I think it will come down to what the reason for the infertility is. And I appreciate a lot of people all over the world are dealing with this. And it's so sad when people are trying to have kids and they're not able to, or they have difficulties with having children. And like I said, it depends on what the reason is. In some cases, actually, there's no reason. And we can't quite explain. We've done all the tests and we don't know why this is the case. I think to kind of address that, maybe I should talk about the reasons or the different causes. So say the infertility was caused by sperm quality, then you might look at referring them on to a specialist who can then think about if there's any causes or reversible causes to kind of improve sperm quality, if they can need to be put on medication. If you're thinking more about the woman side of things, it could either be one of three things. It's either the woman's not ovulating, in which case you might then think about treatments that focus on stimulating ovulation. Some people might go on medication such as clomiphene or Clomid, it's quite popular, to kind of stimulate that process so that they then produce eggs when they ovulate, and then can then hopefully go on to conceive or to have kids. There's also some people might have had, unfortunately might have had infections of the womb and the fallopian tubes, and sometimes actually the reason of their infertility is the fact that there's a physical blockage that's stopping the egg from coming down that tube. So in that situation, just a procedure to kind of help unblock the tube sometimes might help with that. And sometimes when all of these things fail, and we're not able to treat or reverse any causes, in that situation people might then think or look into or consider assisted reproduction.
Okay. Alrighty. Very good. Very good. All right. That's very comprehensive. So you know what to do. Alrighty. So, okay. That's the medical, right? That's the medical world, right? But we hear that Chinese medicine, hijama, maybe yoga, maybe even black seed for like the man, etc. are like beneficial. Is there any truth to this?
There's a difficulty. I can kind of hypothesize as to how these methods can help, but there's not been enough clinical research in this field. And as a clinician, I go with evidence-based. Okay, you have to show me how many people have been trialed on, what was the failure rate, what's the dose of this that they need to have for it to work. And because I don't have those answers, I can't say for certain if these things help. But like I said, I can hypothesize, because some of these things work on the basis of increasing or stimulating blood flow, relaxation, which in all are helpful in terms of someone who's trying to conceive, because stress, as we all know, it's not good for any sort of stress. Is not good for anyone. So
anything.
if there's something that relaxes you enough, then great. That is definitely something that could help with fertility in terms of trying to get your body in the right state to kind of conceive, and not just women, but men as well. But regarding if these things work as a definite, I'm afraid I won't be able to answer that. I can just talk about the other effects of it, but I can't say for certain that if you do this, then it definitely works.
Yeah. Like I'm a pharmacist, but I actually really, because I'm actually interested in also like natural therapy. So people ask me these questions and I'm like, yeah, what I read is this and that. So I wanted to throw this out there, just see if you if you knew anything else. All right. Because I can tell you for certain if it will work. And even if you make, like you said, things that are just out of our control, right?
Yeah.
Any tips you can share, like things people can hold on to today that can help them in navigating this infertility? It's a big question right now.
Yeah. I mean, like I said, it's a difficult, it is very difficult when people are in these situations, because sometimes they can then feel helpless. What I guess I would like to put out there is hope, because I think everyone, if you ask anyone, everyone wants to have their own child that they've both, and I'm saying this for a man and a woman or partners or whatever, they've both conceived together. But sometimes, unfortunately, those things are out of our control. We can try all these things, but there is still hope out there. There's still things to look to. So things like maybe looking into assisted reproduction, and also thinking about all these other kids out there who are looking for a home. It's something that I know that it's usually my last resort when I'm talking to families or couples. But I do say to them that actually, just because you haven't conceived that child yourself doesn't mean that child can never be yours. So it's just I think not to despair and feel like it's all over, but to also just think about the possibilities and the other options that are still available to you. But also look after yourself, so that we don't have to then be thinking about all these reversible things that we could have done. Because one of the things that can cause, like I said earlier on, tube blockages in women is untreated sexually transmitted infections. And it's really important that I mention that, because for women don't get the same signs or symptoms as men do. Men tend to know sooner that they've got an STI compared to women. And unfortunately, in the case of a woman, it might be that this infection has gone on to cause long-lasting damage that will then come to light in the future. So just look after yourself, regular sexual health screens, don't smoke, alcohol, those kind of things don't do your body any good. So even if you're not thinking about fertility, just thinking about your general health and keeping your body in the best condition.
Wow, very good. All righty, so that's good segue. We've talked about a lot of things. You've given us hope. What is one thing that you want to make sure that people take away from this conversation here today?
When you say one thing, do you mean infertility related or just generally?
Yeah. Infertility. Listen, we're now trying to navigate infertility here. So
Okay. Well, one thing I would just say is that don't despair. If you've been trying to have children, don't panic just yet. Keep calm and speak to your doctor. Often there are things that can be done.
okay. Very good. Well, thank you so much. Is there a way people can get a hold of you if they had any questions after the show?
Yes. So I run a women's health page on Instagram. It's Women's Health with Dr. Rasheedah. That's the Instagram handle. So you can send me a DM or an email and I will respond as soon as I can.
So what is that again? Women's, so at
Women's
women's.
Health. Yeah, at Women's Health with Dr. Rasheedah. It's quite a
Oh,
mouthful.
okay. One word. Okay.
Yeah.
All righty, we'll look for you. We'll look for you. So thank you so much for coming on here. This was very informative for me. I learned a few things and I hope you did too. So thank you so much, Dr. Rasheedah. Everybody, make sure you turn on your notifications and subscribe to our channel so you don't miss an episode. It was wonderful having you here. Enjoy your week. Have a good one.
Thank you. Bye-bye.
Bye-bye.
Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.